This is the program that addresses issues concerning you as a Nigerian.
To interact with them.
But what happens afterwards?
I don't know what is delaying the deployment.
That is your role that you have to play.
Investigate each case.
I'd like to hear from some more people.
Talk your own. We the people.
Stella Iwagu can only be a spectator nowadays. An accident she met with 10 years ago changed her life forever.
The nightmare started from even picking me out of the vehicle again. Once again, I was picked in a way that did not respect or protect the integrity of my back. Even I was screaming, my back was broken. They picked me again and put me in a stretcher. To the intensive care unit. When we got there, it was the orderly once again that took me there. And the nurses said, "Who is this? Who sent her? No, we don't have space. Who sent her? Take her away."
Now she's the face of the fight for the right of patients in Nigeria who suffer medical negligence. But the trauma that left her almost paralyzed still lives with her day in and day out.
I thought I was going to die. I felt totally let down, totally abandoned. All my life I had served other people. All my life I had fought for a better system. And it's like the system had failed me just like it had failed many others that I've been fighting for.
Stella was lucky to be flown out of the country in search of medical attention. But the majority of ordinary Nigerians have to make the best of what they can get at home from a struggling health system.
My pain, the beauty of my pain, my tears is not for me. My tears is for all the people that have died. But I sometimes feel like they channel through me. Hear their voices. Help before it's your turn or the turn of your loved ones. Because if there's one system we must all put our hands together to fix, it's our health system. It's our last resort. It's a place where we want to go for hope. But it has become a place where people go to die.
Talk your own.
Talk your own.
Talk your own.
This is Talk Your Own, We the People, a program that addresses issues affecting you and me as Nigerians. My name is Afio Ubasi. Thanks for watching. You know, mistakes are a part of life. But at what point would you term a mistake made during the course of giving or receiving health care a medical negligence? You already heard Stella's story. Does her situation sound similar? Maybe it happened to someone you know, or even to you. I have with me some guests who will be talking about this issue of medical negligence in Nigeria. Let me quickly introduce a few of them. Well, you already met Stella. She's Dr. Stella from the Center for the Right to Health.
Good morning, Nigerians.
Of course, we also have Dr. Enojo Abdu from the Medical and Dental Council of Nigeria. Let me also introduce Dr. Ep4 from Ep4, a consulting group focusing on the health sector.
Good morning,
Thanks for coming. And we have Nurse Adeniji Abdurafiu, the president of National Association of Nigerian Nurses and Midwives, and Barrister Maxwell Okwara, legal practitioner. Thank you, Barrister, for coming.
It's my pleasure.
One more person I'd like to introduce is Dr. Lucky Okweti from the Nigerian Medical Association. Of course, we have the rest of you. Thank you all for coming. We're talking about medical negligence in Nigeria. What's the way out of it? Now, at what point can a mistake in the course of giving medical attention be regarded as medical negligence?
Negligence means that, in summary, that the doctor has failed in his duty of care to the patient.
So how would you know this doctor has failed?
The spectrum is very wide and is actually inexhaustible. But I'll give you some examples. If a doctor makes a wrong diagnosis, especially if the diagnosis is such that every diligent doctor of equal status and competence as him will ordinarily not make that mistake, or he makes a mistake in administering treatment.
I need to throw this question open to the rest of you. How big an issue would you say medical negligence is in Nigeria?
If you take what happens on a daily basis, there is no day you will not have incidences when people go to hospital and they don't receive the adequate care, and what follows is death, especially in accidents. We're all aware that emergencies in hospitals hardly, and I say hardly, do adequately attend to patients that are brought to their care.
Okay, thank you. Well, I actually find it very interesting coming from you, because you're from the National Association of Nigerian Nurses and Midwives. So that takes me to the next question. If this issue is this big, if it's something to worry about, how many medical workers have been punished or sent to jail?
Okay, we have a good number of cases. As at the last count, we have about 40 cases pending between 2012 and 2015.
Across Nigeria?
Yes. Now, when I say 40 cases pending, these are cases that the investigation panel has investigated and established prima facie cases against the medical practitioner or dental surgeon and has referred to the disciplinary tribunal. However, the disciplinary tribunal has not taken them on, as they've not been arraigned before the disciplinary tribunal. There are other cases that are at different stages of investigation. These are over 100.
So what's holding these cases up?
Several factors, but most importantly, the fact that the Medical and Dental Council has suffered several disruptions over time. In the last 2 decades, the council has not been in place continuously for up to 9 years. Each time there is a new government, that is, a new government is sworn in, the council is dissolved along with the management board of other agencies and parastatals of government.
I'd like Dr. Nsofo to say something at this point. What do you think about all he said?
First of all, I think that the numbers that Dr. Abdul mentioned may seem small. However, the council cannot act on cases that they do not get. And this is where we're throwing back the responsibility to the public. People should report cases to the Medical and Dental Council and to other councils, Nursing and Midwifery Council. When they have issues like that, if you feel that your rights have been impinged upon because you went to get care from a hospital, it is your responsibility to report the case and not to leave it to God, for example. Because that is what happens over time. People just say, well, the person has died, it's the will of God, what can we do? That's the way God wanted it. But as long as we keep doing that, they keep having very few cases that are being dealt with by the Medical and Dental Council. So I think that's very important to say that the public has a responsibility to hold the medical profession to account.
No, so he's here. He's a person living with disability. And, you know, in the course of talking with him earlier, he had said that it was due to medical negligence. So I would want to ask Noso at the point, can you give him the mic, please? Noso, what do you think about what's being said now? Did you know where to report when this happened to you?
I didn't know where to report. And just like what he said, you know, many of us will be afraid to report because they will want you to say, how will you prove it? You know, they will require so many things for you to prove it, so that in order for them to prosecute the doctor. But I know that if I was treated earlier when I went to hospital, you know, it couldn't have happened to me. It was later that they now say, okay, they now referred my mom and I to a bigger hospital. So by the time we got to that hospital, the doctor said, oh, supposing we came earlier than this, that it could have been corrected or whatever. So, but we didn't know any medical council to report anywhere.
At this point, Dr. Stella, your organization has been compiling cases of medical negligence against health workers. How easy has this been for you so far?
It's been very, very difficult. They're scared of having repercussions on them. Maybe the hospital or the doctors who are so powerful, you know, you want me to make a case against these big people, you know, so they seem so small even in their suffering. You know, so we just keep telling them, we just keep encouraging them that if you do not report, if we don't make these cases, things would not change. And the other thing is also, it requires patience, because sometimes people want immediate resolution of their challenges. And I have to educate them that this takes process, that it will take a while, but we need to stay on it.
Nurses and midwives have been accused of contributing to high cases of negligence in Nigeria. Now, would you say that you have done enough to check this?
Each state chapter or state in the country has what we call the Nursing and Midwifery Committee. This Nursing and Midwifery Committee are the grassroots bodies, which even if you go to the hospital, even if it has not involved life, maybe you experience certain difficulty, you report this to the Nursing and Midwifery Committee, and it is in every federal state Ministry of Health. After this thing has been investigated, you now refer the case to the national body. Many people are not in the habit of coming to report.
One of the things that keeps coming up is that people really don't come out to report. That's what basically a lot of people have said here.
When you say that people don't come out, when you check this thing, you are talking about your relatives whose body is in the mortuary, or somebody who is already deaf as a result of medical negligence, and you are asking him to be coming from Maiduguri, taking risk on the road, and nothing is forthcoming. But
Please go ahead and react, because I need the Nigerian medical
so that they will know what they will know what they will react. Let me give you this last one. Somebody, your wife is pregnant. You went to the hospital, the first scan, twins. The second scan, twins. The last scan before this thing, twins. Now, the day for the surgery, they took your wife to the hospital and asked you to go and buy one drug. Before you could come, they told you that they have operated your wife. It's only one baby. Now you are not asking what of the placenta. You said that the placenta have given it the cleaner to put in the dustbin. The guy said, let me see the placenta. No result was given. We wrote a petition to police. They were all arrested, all the whole doctors and nurses. At Kuba police station, they were investigated and arraigned in court. Calls were made. After calls were made, they asked the police there to terminate the FIR and transfer the matter to command. Once immediately the matter was transferred to command, nothing came out. I filed action against the hospital. We are still in court now. We have concluded our case. It's for them. Now, only for them now to say that Medical and Dental Council has set up a panel and exonerated those medical personnel. I continue to ask, I asked Wolabi, were you called? He said no. Did they call your wife? He said no. Nobody consulted me. How did you carry out the investigation?
Okay, this is the right point for the medical council to come in. Thank you. This is the right point, please. I mean, that's a practical example now.
The council did not write you. The panel did not write you.
Yes.
You understand?
Yes. They did not hear from us.
The question you need to ask, under the law, did they need to hear from you?
Yes, now. You can act in your investigation.
Let's, Nurse Adeniji say something, and then we'll come to you, Dr. Nsofo.
When you are establishing medical negligence, you want to take certain things into consideration. Their infrastructure, as said here, ideally before a medical negligence is committed, the doctor, the nurses, the pharmacists, the lab scientists, we have to play a role. And in playing that, if there is a very formidable harmony within the health sector, even if somebody is making an attempt to commit medical negligence, the other person is at that place to actually come to the rescue.
Let's also look at the context, Nigeria as a whole. I think generally they're just poor customer care. And we forget that when you get to the hospital, the customer is the patient. When you're talking about the patient having the information to even know what to do, it starts from the hospital. When you walk into a hospital, do you see signs to say, if you have any issues, please call this number or go to this department or to do so and so. By the time everybody, different layers that are involved in this, civil society, hospitals, government, agencies, religious bodies, to begin to demand for the rights of the people, even beyond healthcare.
Okay, so Dr. Stella, you were going to say something.
I just feel like, as a patient, when I walk into a hospital, somebody have certified that clinic have what it takes to be open. All right? Somebody is responsible. So when I go there, I'm expecting to be treated in a certain way. I'm expecting service. I'm expecting basic minimum service. I'm expected to be treated with respect and dignity. Yes. I'm not expected to be yelled at or beaten or tossed at or screamed at.
Or ignored.
Or ignored. And when that happens, so me, I'm holding the nurse, and the nurse is holding the manager, and the manager is holding the CMD, and since the CMD is holding whoever, that is so the responsibility and accountability begin to shift up until somebody pays.
Right, Barrister, go ahead.
If there are some people that are supposed to be more careful, I think it should be the medical personnel. The other day we saw somebody work in a federal government establishment for 9 years, only for them to discover. In fact, it's not even medical council that discovered that that guy is a quack. So they should be up and doing. Like this issue of writing, call this number, do this thing. They should, the accreditation team or investigation team should go to any particular hospital. Please put this thing. If you do not put all these things, we'll close it. I have read their acts from the preamble section to the last. They have the power.
Barrister, what you said is not correct in the law.
It's correct.
I will.
Do you give me 2 hours for me to do the research?
Do you permit me? I'll give you a bet. If you are able to show that in the Medical and Interpractitioners Act, I'm on air, isn't it?
Yes.
I'll give you my salary.
I will take.
You're watching Talk Your Own, We the People, a program that addresses issues affecting you as a person living in Nigeria. Nurses and midwives have been severally accused of medical negligence. We will hear from them after this break. Stay with us.
Talk your own.
Talk your own.
Talk your own. Talk your own.
Talk your own.
Talk your own.
Thanks for staying tuned. Now, does a victim of medical negligence know exactly what to do, where to go to for help?
Good. If you have a complaint against a registered medical practitioner or a dental surgeon whom you have presented to and you believe he did not behave as a doctor ought to behave, you do an affidavit. That is, you state your complaint in the form of an affidavit. When you do that, you send it to any of our offices. We have an office in Ilorin, we have an office in Kaduna, we have an office in Lagos, we have one in Enugu, and the headquarters is in Abuja. You can also send it to our email as a scan.
At this point, let the Madam speak as well, so she can, if she has a question, she can put it to you and you answer all at once.
I am a victim of this medical negligence twice. They said they are on strike. They now send us to Newu Teaching Hospital. Within the doctors, within this consultant, I'm not talking about ordinary doctors, consultants. They were like, it's the fault of this one, it's the fault of this one, it's the fault of that one. By the time they told me what to do on the procedure, I resorted to my faith to say, let the Lord have his way. And I buried my husband. They will tell you, you didn't go to the right hospital, and you went to the specialist. National hospital, is it not a specialist? Then the teaching hospital in Newu, is it not a specialist? I don't want to call names. I know the consultants I met, and they took money from me. They will even ask you to come to the private hospital. And they will say, the taxi you run in the hospital. Imagine them telling me that the hospital taxis are not okay, that they have to go to their own lab. And I went, pay a huge amount of money for a particular tax. And yet, nothing was come out of it. Rather, I lost my husband within the period.
I empathize with you. However, it is people like you who will be very glad to receive a petition from you.
This issue of processes, or protocol, don't you think it's too much? Take, for instance, in my own case, when my wife was being referred from Amana Hospital to National Hospital, on getting to the intensive care unit, I was turned back to go to an accident and emergency, which was my first point of call. And they've called National Hospital that we are coming. So on getting to that place, processes of go and get a card, do this, go here, it's not our case. This was the process we are passing through for more than an hour. My wife was not being attended to, and she lost her life. What are we talking about processes? All these processes should be cut short.
That falls under negligence. If you report it, it's actionable.
I have a friend who lost a friend due to gunshot injury. He was attacked by armed robbers, and they went to 2 different hospitals, and they were asked to provide police report. So, and I know of the National Health Act, which empowers us to be treated, lives to be saved before asking of any other result or any other report. So now, would you consider that negligence or what?
They test me, they say I gave foul blood. They go operate me for National Hospital. I don't know, say a doctor touch my blood, I've been a water, I don't know. As I reach house, I begin the unit without control. I come back to National Hospital. They say I begin do tests. I get one of my mama Lela Dogoyaro. She now asked me, say, Lami, you don't wear? I said, no. See what it can happen to me. She said, what? Mama, come find a lawyer, write petition, come to National Hospital. They begin shock body. Okay. Say, I beg, they go do and. They now can't do another operation for me. This is the way you people they talk. If you not get anybody where something happen like this, I die. Oh.
If doctors are held to account, the outcome improves. Our health sector is so poor because doctors and healthcare practitioners are not held to account.
So the Nigerian Medical and Dental Council will hold them to account?
Not just the Nigerian Medical and Dental Council, the public will also assist us.
I want Barrister to say something. What is the way forward in terms of making laws and policies?
As your association, where you belong, when things are not working well, you're supposed to take it up. It's their own profession. That's why they say all these doctors, they are criminals. All these doctors, they don't even know what they're doing. They will generalize it, and your profession. So that is the reason why you should take it up. Only when you are not paid salary, or when you are not paid your money, that will go on strike.
Okay, thank you very much. On that note, would like to say thank you very much for being a part of the show.
Talk your own. We the people.
We have Dr. Wapada Balami, MNI, the Director, Hospital Services, Federal Ministry of Health, here with us. Thank you for joining us.
Thank you, ma'am.
What mechanism do you have in place for Nigerians with complaints about hospitals?
Yes, we have tried to strengthen the regulatory institutions to see that they regulate the standard of practice of their professionals. Nigerians can complain to any of these regulatory institutions, or in the alternative, they can directly complain to the Honorable Minister of Health. They can put it in writing. We are going to sensitize people who create more awareness in this area if that constitutes a gap.
Several people on this program accused National Hospital and other government hospitals of medical negligence.
We will come in anytime if a patient complains, either if the patient complained directly to the ministry or the person complained to the respective regulatory body I've mentioned to you earlier.
So are you saying that
it is the nurse or the doctor or from the diagnostic aspect, which is the laboratory scientist, if a patient has reason to complain to any of us, any of these institutions or to the ministry, or the patient take the matter directly to court, that person has the right to demand for that, his or her own right.
So are you assuring Nigerians that when there is any form of negligence at all, when we report, something will be done?
In any case, life first, before any other thing.
Talk your own.
Talk your own.
Talk your own.
One major takeaway from today's program is if you report cases of medical negligence, it will go a long way in curbing the issue in Nigeria. Thanks for being a part of Talk Your Own, We the People. See you next time.
Talk your own.
Talk your own.
Talk your own.
Thanks for watching. Continue to talk your own online, Facebook, Twitter, Instagram, and WhatsApp. Remember, for government to work, get involved. No sit down look. See you next week for another edition of
Talk Your Own, We the People.
Talk Your Own has been made with funding from the UK Department for International Development.